What cigarette smoke causes in chronic bronchitis? Cigarette smoke in chronic bronchitis causes number 1, hyperplasia, hypertrophy and metaplasia of the mucus secreting goblet cells. So there is an excess production of mucus or sputum. Number 2, inflammation of the terminal bronchiole, especially of smaller bronchi of less than 2 mm in diameter, causes smooth muscle hypertrophy and hyperactivity. And number 3, increased collagen activity around the airways in bronchitis causes fibrosis. So goblet cells secreting increased mucus and sputum, and smooth muscle hypertrophy and hyperactivity and increased collagen activity causes cough, purulent sputum, fibrosis and stricture causing obstruction to the air passage. For the diagnosis of chronic bronchitis, cough with sputum should be present for at least 3 months for 2 consecutive years. And number 2, severity is related to the number of packs smoked per day and the duration of smoking. Longer the smoking and more the number of packs, the worse the disease. There is squamous metaplasia in the bronchi that may lead to carcinoma. So what are the changes in large and small airways? Changes in the larger airway causes cough and sputum. Neutrophil infiltration causes purulent sputum production. Major site of resistance is a smaller airway of less than 2 mm diameter. Where does the airflow obstruction occurs? Terminal bronchiole narrowing is due to mucus inflammation and fibrosis causing expiratory wheeze and sibilant bronchi, whereas in emphysema the obstruction is distal to terminal bronchioles. So what cigarette smoke causes? Number 1, cigarette smoke produces chemicals that destroy lung tissue. Number 2, smoke is chemotactic to neutrophils and macrophages. Number 3, smoke also causes loss of cilia in the airway epithelium and predisposes to bacterial infection. Number 4, smoke inactivates antitrypsin and antioxidants. What chemicals in the cigarette smoke destroy the lung tissue and how? Oxidants from cigarette smoke, pro-inflammatory cytokines, elastolytic proteinases, interleukin 8, TNF-alpha and CD8 cells. So what do? They lead to neutrophil recruitment that in turn causes macrophage production. What are the cell types and bronchiolar lavage? Mononuclear cells and CD8 cells. More than 95% of the cells are macrophages and neutrophils in the bronchiolar lavage of the smoker. CD8 cells are also present in a smoker's lavage. Important point to note is that stopping smoking in the end stage lung disease does not slow down the inflammatory response.